I have to say I wouldn't call hepatic encephalopathy a dementing illness, although we heard in the previous talk that there may be permanent sequelae of repeated episodes of HE. This is the definition you all know about hepatic encephalopathy. The dementia definition is that more than one cognitive function is involved. It interferes with life and it lasts for more than 6 months. It's more than just delirium, and it is not associated with an altered level of consciousness. And implicit in this, because we don't have disease-modifying treatments for neurodegenerative disorders, is it's irreversible, as opposed to hepatic encephalopathy, which is at least partially reversible. So most of these stages of hepatic encephalopathy, like coma or somnolent semi-stupor in grade 3, that's not dementia. But you might argue that the earlier stages with subtle deficits in quality of life and everyday function could be classed as a dementing illness if it persists for time. And our chairperson, Sarah, wrote this article in the Journal of Viral Hepatitis about what neuropsychological assessments are like to try and detect and monitor the effects of liver failure on the brain. And they specifically mentioned this problem that was brought up in the question time about what may be different about people with viral infections like chronic hepatitis C, and how important all this is to decide whether somebody needs a liver transplant. And the importance of hepatitis C is it can cause structural damage to the brain. There's these things that get associated with hep C, like cryoglobulinemias and things like that, which damage all sorts of parts of the nervous system, including the peripheral nervous system. And you might get a cerebral vasculitis associated with this. And there's a study from Imperial which showed that microglia, the immune surveillance system of the brain, is activated in hepatitis C. So a bit like HIV, which can cause a dementia, you may get hep C dementia irrespective of the liver disease. And I know these tests aren't familiar to me, I use different ones, but it's all essentially, the same sort of principle, that you develop a bunch of tests which allow you by the bedside to decide whether the patient's a bit knocked off or not. And the ones you use, and this seems to be a very popular one, the hepatic encephalopathy score using simple paper and pencil tests, has a number of subtests which get at what I would regard as domain general functions, and I'll define that a bit more later. And so you pick up on whether the patient's a little inattentive, a little dysexecutive, a little slow, and you have a sort of cut off and say this person's abnormal and this person's not. Now, neurologists have been for a long time much more interested in domain-specific functions, and it's all the responsibility of this chap with splendid sideburns, Paul Broca, who has an eponymous area in the brain, Broca's area, which this is the original patient he studied, whose name was LeBourne, but he was known as Tan because that was the only sound he could produce, after a lesion which was said to involve the left inferior frontal gyrus. In fact, the truth were known, this in fact extended very widely subcortically, so this localization was a little bit fictitious. But the idea came about that you had a phrenology of the brain, that this was a place where you had the faculty of articulate language. Now all this is being challenged now. And so here, for instance, is a recent study, and I'm now introducing you to the wacky world of functional neuroimaging. Here's a German group with Katrin Amunds, who very, very precisely define cortical areas. And this is Broca's area, Brodmann's area 45 and 44, not ventral premotor cortex, which is Brodmann's area 6. This is classic Broca's area. This is thought to be a language-specific module in the brain. And here's a group here doing functional imaging. And they do something which functional imagers love to do. They give people 2 tasks to do in the scanner. In this thing, they listen to sentences or they listen to lists of non-words. And then there was a probe after they heard a stimulus. Did you hear this word? Much easier to do for sentences because you can sort of hold the memory of the sentence in your mind. If you get a list of non-words, it's much more difficult to hold that and then remember whether a particular non-word was in that list. And they do a standard sentence minus non-words, and that gives you a blob in the brain. And then they reverse the contrast, non-words minus sentences, and that gives you another blob. And they look at this in relation to Broca's area here. And you can see that sentences more activates this bit, and non-words more activates the blue bits. And this is in 5 different subjects. It's very reliable. You can now define the response of Broca's area. And then what they did is gave the subjects lots and lots of different tasks. And you could find parts of BA45 which were clearly related to the word task, and particularly the sentence task. And all these other tasks, maths, spatial working memory, Stroop tests, all these other tests, which are mostly, not exclusively, non-verbal, these don't activate this part of BA45, but they activate this part here. It doesn't matter what the task is. If it's a bit difficult, you activate it. And they gave hard and easy versions, and you can see the harder versions cause more activity. And you can find that in both Brodmann's area components of Broca's area. And so you now get the idea that, in fact, this bit of brain, which is supposed to be specific to language, has both domain-specific language properties, but also domain general problem-solving functions as well, all mixed in together. The brain is not organised like the phrenologists would like to believe. And then this concept comes in. I think this is going to appear more and more in the liver literature. This is the group in Oxford who discovered that you could actually pick out brain networks just by lying somebody in the scanner and doing a functional MRI study for about 10 minutes with the subject doing nothing at all, just lying there. And you would have these hardwired networks in the brain that just, their activity co-varies together at a very low frequency, about 1/10 of a hertz. You get these individual voxels going up and down together. And it's quite easy to see that in these 3 parts, these 3 components here, it's predominantly visual, but then you've got another component down here which is auditory, another component down here which is motor. Now the way you do this analysis is using an independent component analysis, a multivariate statistical analysis, to pull these networks apart. And what they did in the Oxford group is they went to a brain map, BM, in the States, which has multiple studies loaded up, thousands of them. And these have been the standard activation tasks, you know, a language task minus a baseline task, or a mathematical task minus a baseline task. And people plot out bits of brain that they think are important for language or math or whatever. And they just compared it with their resting state networks, and they showed a lot of correspondence. Just 10 minutes of lying in an fMRI scanner doing nothing, you can pull out all these networks just as easily as doing complicated cognitive activation tasks. And I particularly draw your attention to the system in the blue box, which is a very posterior system, midline and lateral parietal network, with also a midline frontal region here on this sagittal slice. And you can see that when they related to what on the brain map is thought to be cognitive functions picked out, there's in fact no particular cognitive function associated with this. Whereas if you go to the red box down here, this seems to correspond to language type tasks. Just to orientate you, by the way, I'm rushing through this a bit quickly, is just to confuse you. The right side here is the left side of the brain. This is radiological convention. So the question is, what was this system? And this turns out to be something that people are writing a lot about, called the default mode network. And that is some people consider to be your daydreaming center. You have a brain that's either interested in what you're thinking about, what you're feeling internally, retrieving memories, and then you've got other parts of the brain that are very interested in what's happening around you. And you're switching backwards and forwards between the two all the time. You know, and you know how you might be listening to a radio play and you can't shut your ears and the radio play goes on, but you suddenly start thinking, you know, should I have bought an extra pint of milk today when I went to the supermarket? And suddenly you don't hear the radio play. It's all directed internally. And then you switch back to the radio play, and you're doing this the whole time. And the switch seems to operate at a rate of about a few hundred milliseconds. Now you can pull these networks apart. they did it, Steve Smith and his group in Oxford did it by referring to a large database. But you can do it in a single group of patients. So this is something that Fatima, who works with me, did, where she pulled out a whole load of networks like you've seen before. But this is task-related study where people weren't just lying in the scanner, they were doing things. And one of them was a very much propositional language task. They were describing pictures. There's a picture of a car. Oh, that's a shiny thing with 4 wheels that you wash on Sundays, that kind of task. And another task was just going 1, 2, 3, 4, counting. And a third task was a non-verbal, very simple decision-making task. And you can look at all these networks and you can look across all these components that come out of your multivariate analysis. And Fatima, being very diligent, did 55 component analysis. And you can relate them as to what's being active and what's not being active. And there are several components which seem to be very language specific, speech production specific. There's this one here, component 1, but that's a very visual system and an auditory system. They saw pictures and then they heard their own voices they talked, so that's not so interesting. But these 2 red ones here, where language is up and count and decision making is down in both of these are much bigger networks. That network Steve Smith showed for language, but there's also another network that happens to amuse us because it's in the left anterior temporal lobe, and we think that's a very important brain area for meaning. You know, you can't talk about your pet cat unless you know what a pet and a cat is, and that's where you retrieve that kind of long-term memory. But there's also this network here, and this again is a default mode network where everything is turned off when you have a task. Okay, and that's when you're not daydreaming because you're doing tasks. And there's other areas like in the yellow one here, and this is mainly in the right hemisphere, where language is turned off and the other conditions are turned on. These are all networks that are doing other things, perhaps a little underspecified. But in most of these things, there's this midline activation going on in the anterior area. And in fact, when you start breaking up the brain, if you look at this same database and you look in the sagittal view, and this is the anterior cingulate cortex and around there here, you can split this up into multiple networks depending on how it's attached to lateral neocortical areas. And there's a lot of overlap between these areas. So the yellow is clearly linked to a right hemisphere network here on this cartoon, while the red area is connected to a left hemisphere network, but they're overlapping and they're very connected. So everything keeps on overlapping and they're very distributed networks. And the blue here is the good old default mode network that we've talked about. And at the same time, other people have been talking about this concept about you switching to the external world, switching to the internal world, and showed in this very nice study that you've got these red areas which are, I'm paying attention to what's happening around me, I'm doing tasks, and the green areas here, which is a default mode network, I'm paying attention to what's going on inside me. And when you look at the response of these areas, the low frequency oscillations, they're anti-correlated. If you want to think about the outside world, you can't think about your inside world, and vice versa. You have to switch between the two. And this seems to be a very important cognitive function. You're able to switch between the two. And if you do it inefficiently, you become inefficient at tasks. And I've already talked about the overlapping network with this part of the brain. The posterior cingulate cortex here, the back midline part of the brain, is also heavily connected. It's a hugely complicated area, cytoarchitectonically, multiple bits of brain. It's virtually unknown to neurologists because you never get strokes there, so you don't get the lesion deficit analysis from stroke patients. An occasional tumour grows there, but we know very little about it from classical neuropsychology. But if you break this up, using again a multivariate analysis, you can see that this area here isn't just one big blob. It can be broken up into little tiny bits going down here, which have widely different connections throughout the rest of the brain. It so happens that this is the metabolically most active part of the brain, so it must be important in that sense, and it's a part of the brain that gets damaged very early in Alzheimer's disease, for instance. And if you look on with a different technique, Ola Sporns and his Connectome project, this is looking at white matter tract connections and how strongly connected, how hubby is a part of the brain. This part here is that area of the posterior cingulate cortex adjacent precuneus. It's incredibly hubby. It's like Heathrow Airport. It's connected to everywhere else in the world. Well, this bit of brain is like Bristol Airport. You know, it's hardly connected to anything at all. This must be vitally important. And so the idea is that, in fact, multiple parallel networks in the brain, they need to talk to each other. They're doing different things. They're doing memory, language, maths, but they need to talk to each other. And this part of the brain may be a very important hub for it to go through. And the fact that it's also involved in going into the internal world is all about approaching memories, you know, memories about yourself, memories about the world, and that's why it tends to deactivate when you're doing explicit tasks, because, you know, you can't think without memories. And yeah. And where does this relate to hepatic encephalopathy? And I better move on. There's a recent study from Imperial. Simon Taylor Robinson was involved in this, where patients were given a very simple task, a motor task, a visual task. And this shows very nicely that when you're doing these two tasks, you activate the external systems and the default mode network turns off because you're concentrating on doing a task. And this was done in patients with mild hepatic encephalopathy, and they had some psychometric tests. And then they were given a magic treatment with L-ornithine L-aspartate, which apparently does lots of good. And they showed that what changed was that as these scores improved, the activity in the default mode network, this part, went down. In other words, you were better able to turn off your attention to the internal world and pay better attention to the outside world. And it went up in areas like the visual processing areas for the visual task here, so you could pay more attention to the visual stimuli. So when you start reading papers about default mode networks and hepatic encephalopathy, there's a series of papers out here, mainly coming from China, and that's where they're exploring this funny network. So in summary, you can get hepatocellular failure or portosystemic bypass giving you brain failure. There are, of course, biochemical causes which you people understand infinitely better than I do, and it must be the subject of most of your meeting. But studies on these changes at the molecular cellular level have huge impacts on distributed brain networks, which we can also study. And it may be that some brain regions, when you're looking at mild or more severe hepatic encephalopathy, it may depend very critically on which parts of the brain are being poisoned. And it may be, for instance, that the posterior cingulate cortex, this very hubby part of the brain, is very vulnerable to these nasty toxins you get associated with liver failure. And I'll stop there. Thank you. Sorry.